Welcome to PrepCourses. Here, we offer an RExPN exam preparation course, and today I'll be showing you one of our mock exams. A newly admitted patient says, "I just don't know if I should be here. What will my family think?" Using the approach of reflection, the nurse may respond most appropriately with which of the following statements? A. What your family think is not important. It is you that we are concerned about. B. It sounds like your family doesn't understand you. C. It is hard to be here. You are concerned about your family's reaction. D. You can't always please your family, can you? The answer is C. Tip. We need to self-reflect what patient told and how you understood their situation. Additionally, it also helps the patient to verbalize their feeling. Potter and Perry. A practical nurse who received patient should check which of the following prior to initiating IV. A. Check vital signs. B. Explain procedure to the patient. C. Take consent from the patient. D. Check the physician order. Answer D. Tip. An order requesting the initiation of a peripheral intravenous access and administration of an intravenous solution must be made by a physician before implementation of this procedure. Ref. Potter and Perry, page 960. Which is considered insensible loss of water? A. Skin. B. Kidney. C. GI tract. D. Liver. Answer A. Tip. Water loss through lungs and skin is considered as insensible loss of water. The sensible loss of water is through kidneys, gastrointestinal tract. A post-operative infant returned to unit after right side cleft lip correction. Which position is best for the infant? A. Spine. B. Kidney. C. Left side lying. D. Right side lying. Answer C. Tip. Always position the infant in the opposite side of the surgical correction to allow the suture to be intact. Never put infant in prone or supine position because of chance of aspiration. Reference: Saunders Prep Guide, page 389. What is the first step an RPN should keep in mind to make client understand about medication therapy upon discharging him home? A. Teach about each medication. B. Encourage them to read pamphlets of each drug. C. Assess the knowledge about the medicine and its importance. D. Cite some internet sources about medications. Answer is C. Tip. It is very important to assess the patient knowledge. Thereby, the PN would know their knowledge, willingness, or ability to follow a medication regimen. The rest, all other options, will come after this step. Ref. Potter and Perry, page 685. In giving abdominal thrusts for a patient who choked fishbone, how should the practical nurse position her arms to give thrust? A. Above xiphoid process. B. Between the diaphragm and xiphoid process. C. Between xiphoid process and umbilicus. D. Between umbilicus and symphysis pubis. Answer: C. Tip. Place the heel of one hand over another between the umbilicus and xiphoid process. Ref. Saunders, page 167. A child with hepatitis A and skin infection is in your unit. Should the nurse take special precaution or protection when taking blood specimen from this patient? A. Standard or universal precaution will be sufficient. B. Sterile gloves are necessary. C. Protective gown will be required. D. Thorough hand washing after the procedure is necessary. Answer A. Tip. Standard precaution or universal precaution is sufficient, which includes wearing gloves is enough to protect the patient with hepatitis A. How to verify the nasogastric tube placement after initial insertion of nasogastric tube. A. Aspirate gastric contents. B. Chest X-ray. C. Flush air to check swooshing sound. D. Irrigate the tube with water. Answer. B. Tip. This is one of the reliable before initiating any feeding. Checking pH of the aspirated contents is acceptable before any scheduled feeding to confirm the placement of the tube. Potter and Perry, 1090. A nurse is giving a lecture about breast self-examination to high school graduates. What is the purpose of breast self-examination? A. Check for lumps or masses. B. Checking the lymph nodes. C. Palpating with 3 fingers. D. Examine the breast. Answer. A. Tip. Breast self-examination is to check for lumps or masses. Saunders, 250. A client underwent appendectomy. A practical nurse assessed the patient after receiving from the operation room. The patient was crying and restless. Which of the following actions should the PN do first? A. Prevent the infection. B. Document the findings. C. Relieve pain. D. Maintain skin integrity. Answer. C. If the patient is in pain, it should be relieved first. Pain is considered as the 5th vital signs. The patient exhibits restlessness and crying, which are the behavioral indicators of pain. Preventing infection is not the priority. Documentation can be done after management. Maintain skin integrity is not an immediate function. Potter and Perry, 1031. Who is responsible to take informed consent from the patient who is posted for surgery? A. Assigned nurse. B. Anesthesiast. C. Attending surgeon. D. Registered nurse. Answer. C. Tip. The surgeon is the responsible to take informed consent after explaining the procedures, its complications, and alternatives. Saunders, PG 171. Which of the following care shouldn't be given to post-liver biopsy client? A. Position the patient to right lateral position. B. Place a pillow under the puncture site. C. Check for the site for bleeding. D. Position the patient for left lateral position. Answer. D. Tip. Client should be positioned on right lateral position by keeping a wedge under the insertion site to prevent bleeding. Saunders, page 186. Mitchell has a nasogastric tube for aspiration, and a healthcare provider advised to remove the nasogastric tube. A practical nurse is removing the tube, which is not a correct method. A. Ask the patient to take deep breath and hold. B. Remove the tube slowly and evenly. C. Coil the tube around the hand while removing it. D. Remove the tube at a time. Answer. D. Tip. The client tube should be removed slowly, evenly, the course of 3 to 6 seconds. Saunders, page 193. According to the Kubler-Ross, the 5 stages of grief of client are A. anger, denial, bargaining, acceptance, and depression. B. Anger, denial, acceptance, depression, and bargaining. C. Denial, anger, bargaining, depression, and acceptance. D. Denial, anger, bargaining, acceptance, and depression. Answer C. Tip: these are the 5 stages of grief process of a client. Potter and Perry, page 449. A child with sickle cell anemia is admitted in the pediatric unit with complaints of fever and swelling of hands. What is the cause of this condition? A. Vaso-occlusive. B. Splenic sequestration. C. Hyperhemolytic crisis. D. Aplastic crisis. Answer: C. Tip: vaso-occlusive crisis is caused by stasis of blood with clumping of cells in the microcirculation, ischemia, and infarction. Splenic sequestration is caused by pooling and clumping of blood in the spleen. Hyperhemolytic crisis is an accelerated rate of red blood cell destruction. Aplastic crisis is caused by diminished production and increased destruction of red blood cells, triggered by viral infection or depletion of folic acid. Saunders, 371. How can a nurse calculate a woman's due date by Nagel's rule if the client's LMP is September 12, 2016? A. June 20, 2017. B. June 19, 2017. C. Oct 19, 2017. Or D. Jan 20, 3017. The answer is B. Which vital signs remain unchanged due to aging? A. Temperature. B. Heart rate. C. Respiratory rate. D. O2 saturation. Answer: C. The respiratory system usually remains unchanged. Heart rate will be decreased during rest, and peripheral pulse has weakness. Decreases size and number of alveoli, thus may cause an alteration in SpO2. Saunders, 233. When to start the diet of a patient who underwent gastric surgery? A. After 48 hours. B. When peristalsis returns and bowel sounds are heard. C. When patient feels appetite. D. When there is less output in NG tube. Answer: B. Tip: when peristalsis returns and bowel sounds are heard are the signs to start the diet. Start with sips of clear and progress to bland meals per day. Saunders, 599. Which position would be best for a client for respiratory suctioning? A. Upright position. B. Low Fowler's position. C. Supine position. D. Trendelenburg position. Answer: A. Tip: the client is assisted to a sitting upright position, such as semi-Fowler's position, with the head hyperextended unless is contraindicated. Option B, C, and D are not proper position for the respiratory suctioning because chances of aspiration. Saunders, 630. Where should the practical nurse check the circulation of right leg, which is used for cardiac catheterization? A. Right femoral pulse. B. Check the distal pulses of the used extremity. C. Brachial pulse. D. Apical pulse. Answer B. Tip. Monitor peripheral pulses and the color, warmth, and sensation of the extremity distal to the insertion site at least every 30 minutes for 2 hours initially. Notify the physician if the client complains of numbness and tingling, the extremity becomes cool, pale, or cyanotic, loss of the peripheral pulses occurs. Saunders, 674. A client with kidney injury complains of blood-tinged sputum and lung crackles. What will the nurse do next? A. Check the patient. B. Monitor the patient. C. Inform the in-charge. D. Document in the nurse's notes. Answer C. This is due to pulmonary edema because of left ventricular failure, and the client need immediate management. Saunders, 731. What kind of vision for a client who has open-angle glaucoma? A. Myopia. B. Halos around lights. C. Tunneled vision. D. Nystagmus. Answer C. Tip. Primary open-angle glaucoma, painless, and vision changes are slow, results in tunnel vision. Primary angle closure glaucoma, PACG, blurred vision, halos around lights, and ocular erythema. Saunders, 769. A doctor advised CT scan of the brain for a client who has constant and persistent headache. What will the nurse importantly check for this patient prior to the schedule of the test? A. Any history of allergy to shell. B. Make sure the patient is NPO. C. Encourage the patient to stay calm. D. Make sure everything is in the file. Answer A. The nurse should check if the client has any kind of allergy to shellfish or iodine. Saunders. Which one is not the complication of fractures? A. Infection. B. Compartment syndrome. C. Fat embolism. D. Bone weakness. Answer D. The rest, all other options are complication of fracture. Saunders, 846. Which clinical symptoms help the nurse to interpret the diagnosis of SLE? Weight gain, oliguria, butterfly rash, bleeding gums. Answer C. Tip. Erythema of the face, malar rash, also called a butterfly rash. Saunders, 875.